Assalamu alaikum. Now the clinical case cerebral palsy, and it's a very common case. Hemiplegic CP, diplegic CP, quadriplegic CP. So main differentiation is, can the child walk? If walk, that may be hemiplegic, monoplegic, diplegic CP. And if it not walking, bedridden, so maybe quadriplegic CP, maybe diplegic CP. So first of all. I have one video for the neurology examination and wash my hand, introduction myself, and permission and rapport formation, and then um, uh, looking for any dysmorphic face present or not, any dimension, what's the dimension, any device present or not. If device such as special shoes is present, we have to check the shoes, and then there is any pain, and then we have to do it very swiftly, because if then we can ask that uh, can he walk, and if he can walk, so gait, a normal gait, and then tiptoeing, then heel gait, and then a fog sign present or not. And then here we can judge that is there any hemiplegic gait, diplegic gait present or not. And then before asking the child to lie down, we can check the back, is there any scar present or not, any especially dorsal rhizotomy present, may be present. And then will please sit, and if the comment is examine the motor of the lower limb, suppose is quadriplegic CP, and we know in case of quadriplegic CP, child is bedridden, so no need, and we just ask if he can walk. If mom said no, he can't walk, so our examination is more simple. So we will first inspect what inspection from the head side, is there any squint present or not, any drooling present or not, and then what is the posture? There may be dystonic posture or skip posture of the lower limb, and is there any contracture, any scar mark present, especially the release of the tendon is present or not. And here there needs more empathy and sympathy, and we will look for in is oriented or not. And then in the lower limb examination, a tone, and then power is not as is can to work, so uh, power maybe 1 to 5, 1 by 5. And what is the reflex may present, hyperreflexia, maybe bricks may be present, because due to contracture we may not initiate the reflex. And then plan baby and positive present or not, and coordination if not possible, as the child is not can follow my comment. And to complete my examination, I want to do the sensory examination and upper limb examination, head, do the anthropometry, head circumference, and the back examination, and the cranial nerve examination. And the presentation, we have to give the presentation very shortly, but gist presentation, and it will take maximum 40 to 45 seconds. So John 7 years, thin looking with gross muscle wasting in four limbs, there is skip posture or dystonia, he is not oriented, having squint, small hand, ng tube in situ, there is crossed leg in lower limb, hypertonia with contracture, power 1 by 5, reflexes bricks, and baby and positive. Okay. So what's the diagnosis? Is maybe quadriplegic CP, or if it is not from the gait and the examination of the motor examination of the lower limb shows there is hemiplegic CP, so it's the case of quadriplegic CP. So what may be the causes of the cerebral palsy? So natal, prenatal, natal, and the postnatal cause. Prenatal cause, genetic cause, cerebral malformation, maternal substance, alcohol intake, maternal touch infection, UTI, IUGF, prematurity, large for gestational age, multiple pregnancy. And neonatal causes neonatal encephalopathy, hypoglycemia, jaundice, and postnatal cause meningitis, encephalitis, brain abscess, trauma, head injury, stroke. And if it is hemiplegic CP, so Presentation may be Peter 5 years old having hemiplegic gait on the right side, and there is muscle wasting on the right side. Muscle tone is increased, and reflex is breaks, and Babinski sign is positive. So it is hemiplegic CP. Hemiplegic CP, antenatal, prenatal, natal, and the postnatal cause, along with the VIP, is cause such as the vascular cause, bleeding, atriovenous malformation, NAI, periventricular hemorrhage, thromboembolism due to sciatic congenital heart disease, infective endocarditis, cardiac surgery, vascular moya acili, tracheostomy disease, thrombosis, homocystinuria, positive family history of thrombophilic disease, infection, meningitis, encephalitis, brain abscess. P for the patient, hydrocephalus, and S for the ixon. And this is the hemiplegic CP. And suppose it's a case of quadriplegic CP. So what investigation? In choice of investigation, MRI, for MRI of the brain for microglia. I first of all, I'll go through his grade book, what investigation and what treatment is going on. And I will do the formal vision hearing and the developmental assessment and treatment of the acute condition, as he has there's contracture, spasticity, drooling is present. So it is acute management and then long-term management. For this spasticity management, medical management, surgical management. Medical management by the baclofen, clonazepam, and injection botulinum toxin, supportive splint, special shoes, surgical elongation of the tendon, Achilles, selective rhizotomy. And for the drooling management for exercise, anticholinergic medication, injection botulinum toxin. And long-term management via the multidisciplinary team, community pediatrician, neurologist, orthopedist, physiotherapy, occupational therapist, speech and the language therapist, social worker, other professionals according to the child's condition. And what are the associated comorbidities associated with cerebral palsy? Associated comorbidities are spasticity, feeding problem. From the head, we can say that that's vision and the hearing problem and feeding problem. There is drooling, increased chance of aspiration, malnutrition, and choking, unsafe swallowing may be present, and then intellectual disability, seizure, bladder dysfunction, sleep disturbance, abnormal pain and touch sensation, weight, sore, constipation. There may be another question, maybe pseudoverbal palsy versus the bulbar palsy if the child has drooling. So the difference is that pseudobarbar palsy, gag reflex will normal or increase. In case of bulbar palsy, gag reflex absent. Speech, spastic dysarthric speech in case of pseudobarbal palsy, and flaccid dysarthric in case of bulbar palsy. And tongue is in case of pseudobarbal palsy, small and rigid, and verbal palsy floppy. In case of hemiplegic CP, usually one side is affected and Babinski sign positive. Diplegic CP, four limbs affected, but lower limb is more affected than the upper limb. And then the quadriplegic CP, here four limbs is affected, equally affected, and Babinski is positive. And double hemiplegic CP, here four limbs is affected, but one side is more affected than the other side, and Babinski is positive. Other CP is dyskinetic CP, mixed CP. And there may be one condition, hemiplegia with facial nerve palsy. If it is upper motor type of facial nerve palsy plus there is uncrossed hemiplegia, solution is above the pros. And if it is crossed hemiplegia, lower motor type of facial nerve palsy, that is Bell's palsy plus crossed hemiplegia, lesion is below the pons. Now the classification of CP, classification according to the tone and movement. So this may be spastic CP, dyskinetic CP. Under the heading of dyskinetic CP, dyskinetic, choreoacetal CP, ataxic CP, mixed CP, such as spastic plus dyskinetic CP. According to the distribution, this may be unilateral or bilateral, such as the diaplegia, quadriplegia. And according to the functional classification, level 1 is he can walk without limitation, but there is a limitation in the speed, balance, and coordination. Level 2 is work with limitation but without any assisting device. And level 3 is work with handheld mobility device. And 4 is limited self mobility. Child may use powered mobility independently. And level 5, severely limited self mobility even with powered wheelchair. These are the all the question may be asked in case of cerebral palsy. Thank you. Assalamu alaikum. If you like this, so give you like, and it helps me and it inspire me to make or record this video recording or just audio recording, and it's a kind of sadhgah jariyah. If it is helpful for you, then it is my reason of happiness. Thank you. Assalamu alaikum.